Fever is often a hallmark symptom of pneumonia, and for many people, this fever comes on abruptly, kind of comes on all of a sudden. And for many patients I've had throughout the years, sometimes that fever can get pretty high. Also, cough. Now, that is something, especially as a family doctor who I'm seeing patients in the outpatient setting, that means not in the hospital, a cough. Often, if it goes on too long, a certain type with other symptoms, etc., often triggers me to thinking about, does this patient have a pneumonia? So a cough, the cough can be what we call productive or non-productive. That means the person may be coughing stuff up or doesn't have to be coughing stuff up, okay? I would say another hallmark symptom of pneumonia is shortness of breath. Oftentimes there's a sort of this shortness of breath, trouble getting air. And something I'll say, again, with my experience being in the outpatient setting, often along with that, what I see is sort of general fatigue. My patients will be like, gosh, I'm just winded. I'm just tired. I'm just exhausted. That sort of sense of fatigue along with the shortness of breath. Guys, it's good to see you. I have more symptoms to tell you about. We are talking about pneumonia and how you might know if you have or tell if you have pneumonia or not. Of course, the only way, surefire way to know is to go to your doctor and to be examined, to be evaluated, and to be treated. So you must do this. But let me continue giving you some other symptoms. So fever, shortness of breath, cough are really, really big ones, okay? And by the way, this video is only for adults. I'm not talking about little kids here, okay? Did I say I'm Dr. Jen? Stop. I'm Dr. Jen. It's good to see you. All right, other symptoms that someone may have. You can actually have gastrointestinal symptoms. What do I mean by that? That is things like nausea, vomiting, diarrhea, things like that. That tends to be less common with pneumonia. Not everyone gets this by any means. By the way, not everyone gets fever, shortness of breath, and cough as well, but those tend to be very common symptoms. But some people can get these gastrointestinal symptoms, the nausea, vomiting, diarrhea, etc. Many times when people have a pneumonia, they have an increased heart rate. Their pulse is elevated. And that is something that I would say is not specific to pneumonia. It tends to happen when we get sick. When people are ill, when we are ill, our body kind of goes into overdrive to help us, to try to make things better, to fix things, or it's either responding to what's happening to our body, and a heart rate going up is something that we often see in terms of, in the cases of infection. By the way, stick with me because I'm going to tell you what causes pneumonia, how we classify it, and then just a little bit about treatments and stuff like that, okay? The other thing is, some people get what we call pleuritic chest pain, meaning they get pain in their chest when they cough or they breathe, okay? That's called pleuritic chest pain. That can happen with pneumonia. Also, work of breathing. So sometimes when people have pneumonia, I mentioned that they may get short of breath, they may feel winded, fatigued, but they also may have to work harder to breathe. And sometimes you may see people literally, like their whole body, their whole sort of rib cage, working to help them breathe, their intercostal muscles, etc. Okay. I mentioned the fatigue part again in the outpatient setting. That is something huge that I see is my patients, when I diagnose pneumonia in them, oftentimes they're like run down, worn out, etc., in addition to other symptoms. By the way, not everyone gets all of these symptoms, as I mentioned that before. Let's move on to a few other symptoms. Now, if you have a weakened immune system or if you're an older adult, your symptoms may not present like the classical fever, cough, shortness of breath that I mentioned that many people have. Sometimes when people are older or they have a weakened immune system, sometimes their symptoms actually may be less severe, or they may not even have a fever, as an example, or they may have what we call atypical symptoms, right? So someone may just have what we call mental status changes, where they just get confused. And that is maybe the only sign that something is wrong that their family may have, and then a pneumonia is found, okay? Sometimes people end up feeling weak, and that might be the only sign, and on further evaluation, it's discovered that the folks have pneumonia. Pneumonia is serious because it can lead to other problems, sepsis, bacteria in the blood, and other problems, kidney problems. It can be a big deal. There are different types of pneumonia. What is pneumonia? And let me go back to that, right? What is pneumonia? It's an infection in one or both of your lungs. It's an infection. Okay, that's what we are talking about, in one or both of your lungs. Now, the infection could be due to a bacteria, it could be due to a virus, it could be due to a fungus, okay? Any of those things can cause pneumonia. In addition, there's something called aspiration pneumonia. That is when if we accidentally sort of breathe in food or fluid into our lungs, an infection can sort of develop secondary to that, okay? We also categorize where the person might have gotten the pneumonia, right? Hospital-acquired pneumonia, they get it from being in the hospital versus community-acquired pneumonia, etc. There's other classifications. What's really important for you to know, though, is that for many of these types of pneumonia, there are treatments, and that is important, okay? So we've got antibiotics, we've got antivirals, we've got antifungals, we've got different medications. Your doctor will decide what you need. But that's why, if you're watching this video because you're wondering if you have pneumonia, let me say this, and I don't usually say this in my videos, but it's important. If you're watching this video because you're wondering if you have pneumonia, I can pretty much tell you that you should be seeing your doctor or some doctor, okay? Because if your symptoms are such that you're wondering, hey, is this something more? Is this something more than just a cold? Is this something more? That automatically should be a sign to you to go to urgent care, go to the emergency room, see your doctor, call your doctor, run it by them, okay? If you're watching this video because you simply want to know, well, that's fine, okay? But I know that we oftentimes use videos to sort of say, hey, what could be going on? But if you're asking yourself if you have pneumonia, you probably should be being evaluated. This was just sort of a quick and dirty overview of many of the main symptoms that we see. Obviously, this is not 100% slam dunk. Again, not everybody has all these symptoms. It varies depending on the person. But just know that a pneumonia is potentially serious and should be treated and evaluated appropriately. Guys, I'm Dr. Jen Caudle. I'm a practicing family physician, on-air health expert, and video creator. Let me know in the comments if you've ever had pneumonia, what your thoughts are about this video, if it was helpful, what your experiences are, because sometimes what you write helps other people. Also, I encourage you, please share this video with anyone else you think might benefit from it, okay? I want to spread the word to empower you, again, to seek medical care and communicate how you're feeling appropriately with your doctor. By the way, I'm on pretty much all social media channels. This little hair, I don't know if you guys can see, this little hair is not doing me any favors, so we'll just kind of stick this down. For those of you on Facebook, please like and follow my page. For those of you on YouTube, hello, please subscribe to my channel, click the little bell for updates. I do daily videos. I'm on TikTok, I'm on Instagram, and all the other stuff at Dr. Jen Caudle. And guys, something you should know is I have a free weekly health newsletter that goes out. Please go to my website. My website is drjencaudle.com. You can sign up for my free health newsletter as well. And then, again, let me know how you feel. I know I have not had pneumonia that often in my life, in my adult life, but I know even the times I've been worried about pneumonia, I have felt really, really sick. And I know that if you are wondering, again, if you are wondering if you have pneumonia, chances are you might be feeling pretty sick. I want you to make sure you get appropriate care. All right, guys. Love you all. Take good care of yourselves, okay?